Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University. I want to talk about an issue that comes up periodically, and that is how do you follow the data related to COVID-19? Every week I record all these videos and I show line graphs. Some go up, some go down. I show different patterns. I show color-coded charts and maps. I have lines over time. I have bar charts, but I've never really stopped to talk about how you should follow the data. So let me give you 5 pieces of advice. First of all, follow weekly or biweekly data. Day-to-day data is simply too short, and month-to-month is too long. So let me show you what I mean. If you take a look at the new daily cases in Tennessee since the beginning, and let's take a look just at the last week or so, and what you can see, each of those lines represents 1,000 cases a day, and it goes from 1 to 2 to 3,000. So day-to-day doesn't really tell you that much. At the same time, if you take a week-to-week look, you can see a pattern that starts to develop. It goes up, it looks like it's leveling off, and maybe even coming back down. Conversely, if you wait and do month-to-month, that's really too long. Look how much change happened in the month of June 25th to July 25th. The second piece of advice I would have is use deaths, not cases. The problem with cases is the terminology gets confusing. So what you'd like it to be, you'd like cases to be how many people are infected. But that's impacted by so many different things. How many tests are done? Who do you test? Do you test people that are asymptomatic, people that are sick, and so on? The more tests you do, the more cases you're going to find. The more people that the more you target your tests, and so on. And then there's even an issue of how you define a case. Ideally, a case is someone with symptoms and a positive test. But it could be someone who has consistent symptoms but waiting for a test result, or someone who's been in contact with a known positive who has symptoms but hasn't been tested, someone with a positive test and no symptoms, and so on. So use deaths and not cases. Thirdly, use rates and not numbers. So let's compare the United States, Mexico, and Belgium. All right. If you look at the number of cases, it's really hard to even see Mexico and Belgium there. The U.S. has many, many times more cases that have been reported. If we look at deaths, it's a little bit closer, but you can still see the U.S. is 3 times what Mexico is and many times what Belgium is. But if you look at deaths per million, that's how many deaths there are per million population. And you can see that Belgium is actually twice as bad as Mexico, and Mexico and the US are really quite close to each other. So you really need to use rates and not numbers. All right. The fourth piece of advice is look at trends over time. If we look at Belgium, for example, even though it's been very badly hit by the pandemic, it's been relatively flat in terms of total deaths for several months. The US, on the other hand, is still growing, but not that quickly, and Mexico, on the other hand, is growing quite quickly. So if you follow weekly or biweekly data, use deaths and not cases, use rates and not numbers, look at trends over time. And the last piece of advice is look for yourself and always be skeptical of bold claims. This is a complex issue, the complex pandemic, but following data is really quite simple if you're systematic and focused on it and follow these 5 pieces of advice. There's lots of other information about COVID-19 on our college website if you go to this icon and click on it. And if you have any specific questions, please contact me. Many of you have. I'm happy to try to do short videos or answer you by email. Look forward to talking to you. Thanks a lot. Bye-bye.